morning, everyone. Welcome to Caritas Healing Connections, this June 15th meeting. And I'm glad you all decided to spend some time with us today. And I want to present to you Patti O'Rourke, and I think many of you know her already, but I'll give you a little introduction. She is a lifelong learner. She's been in nursing 60 years, so she can't give it up. And she's still going, she's still working. And I love her description of herself. She is a joyologist, which she is, a nurse healer, an educator, a mentor, a coach. She worked in critical care, in psych, in civilian, Navy, VA. She's an educator on the side. You know, she's worked in community colleges, universities, hospitals, senior centers, you name it. Wherever she can share her wisdom, she does it. All right, she's been practicing these these energy modalities for over 40 years with anybody who gives her permission, be it a patient, a family member, a friend, or staff. So I'm presenting to you Patti O'Rourke. She is unique. You'll enjoy her.
I've been called lots of things, but unique is fine. Thank you very much. So welcome. How I usually start this, because I've been working with our veterans for the past 20 years, and I'm usually invited to one of their groups by a psychologist or a social worker, or in the community living center, which is our nursing homes. And I would say, do you know anybody that is in pain? Do you know anybody that has trouble sleeping? Do you know anybody that's under stress? If you do, you're in the right place. So thank you for joining us this morning. And I would really like to start off with what I do with our veterans, okay? Because of where we're at with our veterans and trying to help and heal them and really empower them and equip them in our whole health program that we now have in the VA system. So if you want to, all this is always voluntary. I just want you to look at one of your hands, okay? And this is the wouldas, the couldas, the shouldas, the if onlys, the regrets that make us sad and depressed and sometimes guilty. And then look at your other hand. And this is the anxiety that's with the what if. What if I come down with cancer? What if we go to World War? What if I run out of money? What if my kids don't talk to me? What if I can't get this computer to work, okay? And we wind up with being worried and anxious. And we're living in these two worlds, the past and the present. And Deepak Chopra said, yesterday's history, tomorrow's a mystery, but today is a gift. And that's why we call it the present. So how do we get into the present moment? If you just shake your hands and put them over your heart, you can feel your own heartbeat. You can feel your own breath. And the breath is the spirit of what we are in the present moment. And when we get sad or depressed, or when we get anxious and worried, we either hold our breath or we speed up our breath. So breath is the anchor that can help us deal with our stress. So to practice breathing, if you've been a deep sea diver or if you've been a singer, you already know about diaphragmatic breathing, but some people don't. So I start our veterans out with having them put your hands on your belly and blow out through your mouth. Now, when you take a breath in, I want you to put your tongue behind your upper teeth and your upper palate and breathe in. And just feel your tummy rise, not your chest and shoulders. Okay, so blow out again, push that tummy in, breathe in with just your tummy rising. This is diaphragmatic breathing. This is soft belly breathing. This is the gateway to our parasympathetic nervous system. So if you think this is what stress is, this is when we're angry, if you want, make a fist. This is how we walk around uptight. And this is the sympathetic nervous system that makes us fight or flight or fawn or fake it. Now open your hands slowly. This is your parasympathetic nervous system. What a difference to be in one and the other. And how do we live daily if we're all walking around like this? And of course, yes, we have enough in this world that makes us this crazy. And we forget that we have our beautiful breath that can bring us back into our vagus nerve, our 10th cranial nerve, that will help us get into our parasympathetic nervous system. So let's do that breathing again. Breathe in through your nose with your tongue on the roof of your mouth, and slowly breathe out through your mouth. And go at your own pattern, your own speed. And this takes practice. So make it, if you're picking up the phone, practice. If you're at a stoplight, practice. And this is one of the best ways. You don't need any tools, any kits, nothing. You just need your own breath. And using that breath can all of a sudden decrease our blood pressure. Okay. Help us feel relaxed, decrease our heart rate. So this is one of the best things. If anybody has white coat hypertension, if they go see the doctor and they take your blood pressure, it's really high. You can just say, wait a minute, practice these breaths and your blood pressure will drop. And then you won't be put on antihypertensives. And if you really make this a day in, day out practice of your life, then you may need to check with your provider and maybe not need so much of your antihypertensive medications. So we all know that stress aggravates our pain. Stress aggravates our inability to sleep. We can't worry ourselves to death sleeping. So that's why we don't get quality sleep. So I'm going to go over these modalities, and I just use them. Like I say to our veterans, I say, this is a buffet. And you're going to get a little of each to deal with it and pick and choose, because some of you take aspirin for pain, some of you take Tylenol for pain, some of you take ibuprofen for pain. So you're going to have different choices. And this is what I'm offering you, is this buffet, this smorgasbord of complementary modalities that help us heal. And we don't have to deal with pain medications or it's just wonderful things that I've been able to share across my over 40 years of being involved with complementary modalities. So how many of you heard the medication Valium? And right, everybody gets that for stress, right? Oh, you're going through hot flashes, you need Valium. Okay. Or you're upset and you need Valium to calm down. Well, do you know that we have an acupressure point that's in our body? So right where your elbow creases on the inside, right where your crease ends, that's your Valium point. That's heart 3 in Chinese medicine. So I want you to just rub it and see if it's tender. And then take the other side, bend your elbow, find where the crease ends, and rub it. So is there one that's more tender than the other? Did you notice that there's one more tender than the other? So interesting. If it's your left arm where it's more tender, that means you're allowing the outside world to make you crazy. And if it's your right side, you're making yourself crazy. So imagine this is what we do to ourselves. So now you know I can let me breathe. I can breathe this away. So that's one thing that our body helps us. Our body talks to us. Okay. The next one, which is the one that I love to do because it also helps with helping you sleep at night. If you wake up during the night and need to go back to sleep, or you can't get to sleep, this is one thing that's for anxiety and for sleep, and it's called ginseng do. So ginseng do is wonderful because you do not need to, choose one hand over the other, one thumb or one pinky over the other. You start whatever hand you want to. And you know how like babies grasp and hold on, right? So do that. You don't have to hold it tight, okay? And do that belly breathing. You're just going to take a couple of breaths in through your nose and out through your mouth. In through your nose and out through your mouth. And then go on to the next finger. Or if you started at your pinky, you're moving that way. It doesn't matter. Breathing in and breathing out. Again, moving on. And what's nice about this is we have 6 meridians on every extremity. So what we are just doing is helping balance those meridians. And then once you finish the one hand, go on to the other hand. And like I said, it doesn't matter if you start with your pinky or whether you start with your thumb. And some of my veterans fall asleep without even getting to their other hand. So just to let you know that this does work. And that's called Jinsen Do. And then, of course, at the end, I'll be doing a chakra connection, which is all energy works for pain, all energy works for stress, and all energy works for, obviously, insomnia. So if any of you haven't used therapeutic touch, healing touch, or Reiki, if you want, I've left my name and number in the book. If you don't have somebody close to you, I can do a long distance session with you so that you can experience it, because it does work, whether to relieve pain, whether to relieve insomnia, because even if you're on a massage table, you'll fall asleep, or you feel more relaxed. So all of the energy work that I know, and I there are other energy practitioners, but I do just therapeutic touch, healing touch, and Reiki. So please know that if you don't have somebody in your area, find somebody or call me up or email me, and I'll definitely do a long distance session with you so you can experience it.
Patty,
Yes.
Denise has a question.
Okay.
No,
Yes.
I think that was just from my hand being up doing the meditation.
Oh, okay. Oh, that's what I see, the hand up in the little corner. Okie doke. Okay, so the next one, which is I could do a whole session on laughter. But what I ask our veterans, I ask them, when was the last time you laughed? Some of them can't tell me. They can't remember. They don't even know what it is to smile. So laughter is so important. And we all know that from research. So since you're not with me, my veterans get 2 goodie bags, okay? And in the goodie bag is a straw, because years ago, teaching this, I used to just put a pen in my mouth. Because even if you can't smile or have nothing to laugh about, when you put a pen in your mouth, or the straw now, okay, that makes the same muscle to tell your body that you're smiling. And so it raises your serotonin levels. And of course, many of my veterans are on SSRIs. They're on antidepressive medications. So during COVID, I said, because everybody's behind a mask, I said, well, at a time you can just walk around with a straw in your mouth, so, avoid depression. So that's one way of dealing with stress. Now, the other thing that they all get in their goodie bag is they get bubbles. So when you have bubbles, you blow your troubles away, but you're also using that expressive long breath out of your mouth, which keeps your alveoli open and allows you more oxygen to exchange the carbon dioxide. So this is very good for my veterans with emphysema or COPD. It helps with their breath and their breathing, because when you can't catch your breath, you get scared. So this is another thing that they get as in their goodie bag. And then, of course, I already said your energy work, which is also adding Tai Chi and yoga. And Denise is wonderful, who's in here in our group. She does a wonderful, wonderful smiling, laughing, all different types of how we can heal through that type of venue. So our veterans do that. They have chair yoga, they have laughter yoga, they also have, standing up yoga, and they have sitting down Tai Chi and regular Tai Chi. So the other thing, if any of you have had hot flashes or what I call power surges, you know, you can get stressed out about that, or it wakes you up in the middle of the night. So needless to say, we have another acupressure point from wonderful Chinese medicine, which is called a Sanjiao meridian, which is if you make a wrist, bend your wrist. Can you see me bend your wrist? Put your 3 fingers down, and where your pointer finger is, that's the Sanjiao meridian to either warm you up or cool you down. Your body knows what you need. So you do it on the other side because Chinese love balance, right? And our bodies love balance. So where you have your first crease, ring finger down, and your other 2 fingers next to it, and where your pointer finger is, that's the point. That's the Sanjiao. That's triple heater, triple warmer. That will warm you up or cool you down. You don't have to stick a needle in it or anything. You don't have to press real hard. Just, in fact, if you want, you can just rub like this, you know, once you know accurately where it is. But the nice thing about this is if you just cup your finger and thumb, you see what I've just done? On this side is pericardium 6. So you could do the same thing where the crease is 3 fingers above. Pericardium 6 is for nausea. So those of you that have gone on fishing boats that give you the bracelets, or you've gone on a cruise ship, what we're now doing with the National Cancer Institute, we're using this for chemotherapy. So how wonderful that we can use pericardium 6 for nausea. And think about our women that are nauseous, you know, being pregnant, you know, the first trimester of pregnancy, if they knew about pericardium 6 to help with nausea. So the blending of Eastern and Western medicine is so important because each has many gifts to help us heal. So that's enough about stress. Let's go to pain. So how I ask our veterans about pain is I initially invite them to just turn their head from side to side. So just turn your head and see what your range of motion is. I don't want to see The Exorcist. I don't want to see, you know, that'll make them laugh too. I just want you to notice, just notice where your range of motion is, okay? And then I want you, even if you have earrings in, be careful. I want you to rub your ears top to bottom, inside and out, till they get tingly. Rub, 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 tingly, tingly, tingly. Now turn your head from side to side. And that's when you get oohs and ahs. It's like, oh, how did that happen? What we've just done is we've massaged our whole body. In reflexology, this is your whole body. This is an upside down fetus. So if I can share the screen for a second, I think it might let me. Yes, good. This is your whole body. So you see, most of us, when we get our first earrings, where we get our earrings, it's right where the eye is. So isn't that interesting? So you see your whole body, it's an upside down fetus. So I'll just stop and show you some of the things. When we talk about pain, we talk about, oh, you're a pain in my neck, right? Our body listens to everything I say. So why do we allow ourselves to say, oh, you're a pain in my neck, you're a pain in my A double crooked letter, you're a pain, or I have the weight of the world on my shoulders. And our body says, oh yeah, we do. And so now, you know, if it's my back that's hurting me, I just have to rub here. Just go, you saw where that was. You can look up on, you know, now that we have computers, you can look up ear reflexology and see what's a point that's bothering you. And then there's the wonderful one with our veterans. They were so excited. Our young OIF, Operation Enduring Freedom and Iraqi Freedom, they were the ones that came to the VA wanting battlefield acupuncture because that's what they had in the field, because your ear was the only thing that was exposed because you had your helmet on and your vest on. And so one of our doctors out in the field said, instead of doing acupuncture, did battlefield acupuncture, and just with 5 spots was able to manage and stabilize patients. So our young veterans, once they got out of active duty, came to the VA saying, I want battlefield acupuncture. And some of our VAs now have, large living rooms with recliners, and our veterans sit in the recliner and they go around and do battlefield acupuncture so that they don't need opioids, they don't need narcotics. And then they also have the little pins where they can actually press it in between their visits. So when I talk about managing pain, managing stress, and where our VA has come and what we offer our veterans and offer our staff, because now we have employee whole health too. So that's the exciting thing about marrying Eastern medicine and Western medicine. Now, the other thing is, I don't know if you've heard of people that they have a headache and they use Hey Goo, which is large intestine 4. So this part right here where your thumb and your forefinger come together, there's a little V, and that's what you press. And when I tell them that, I say, now you have to be careful, because if you're having, a headache, is it related to obviously high blood pressure? Or is it related to when was the last time you had your eyes checked? Or what's going on? So Hey Goo is a general pain management, and you do both sides. And I can tell you, I got a free gallon of gas one time because I went into the store and the little operator was having pain. And I said, oh, well, just try this and that might help you. Well, it took her pain away. And she said, oh, please, thank you so much. Your gas is paid for. So, a simple thing like that. I mean, when you imagine, now migraines are different. Migraines truly need energy work, whether therapeutic touch or healing touch, to deal with a what we call a sealed energy leak. And that's what the energy work does, heal that. Now, I told you about the goodie bag. Well, in the goodie bag is Sombra. I don't know if any of you have heard of Sombra. This is a miracle salve that I have used now for over 40 years, okay? And to show you how long ago I've used it, how many of you know the medication Darvon or Darvocet? So that's ancient medicine. Well, one of my young nurses, her mother was using her Darvocet like M&Ms. She was taking it every 2 hours. Now, that's not healthy. So years ago, we didn't have, like now, like I said, in the goodie bag, our veterans get just a little packet of it. They didn't have that 40 years ago. And you really don't, this can last a whole year. So I made a jar for the mother, and the young nurse says, oh, Patty, she's using it all over her body as like lotion. And I said, as long as she doesn't use it on her tush, get it in her eyes or in between her toes, she got off the Darvocet. So when I say that things like these work, and like I say, it's a smorgasbord. So if you like BioFreeze instead, okay, or if you like lidocaine, these are all available on Amazon nowadays. And then the one that I also love, which I sometimes use in combination with Sombra, is Arnica. And they're wonderful pain treatments of pain. So that's the exciting thing about that. Now, has anybody had sinus problems where your nose gets all stuffed and so those are the tips of your fingers. So here you can rub it from or you can take one finger at a time and rub the tips of your finger. And that's for your sinuses, and your sinuses will start to drain. Don't forget to do your thumbs. So you can do it all together or one at a time, but don't forget to do your thumb if you do all 4 together. That's for sinuses, okay? The next one is, anybody have arthritis anywhere in your body, okay? You have, in Chinese medicine, we call them achi points. Achi points are in between your fingers. So you take your time in between each finger and between your thumb and your forefinger. So you're also activating Li4 too, Hey Goo. But these are your achi points that will help with arthritis. Now, remember I said about doing the ear for your neck. So if you've really got bad neck pain, so first do the face on, doing your ears. And then what if your neck is really sore, once you've done it front ways, turn to the place where it really is more sore, and then do it again. And that will relieve that pain too. So,
Patty, did you go through that list of you started with Sombra, Arnica?
oh,
So
okay.
they're asking,
Okay. Oh, yeah. These are all available in Walmart and now in in on Amazon. So Sombra, I think this jar costs $6 or $7. And so you saw the little packet that I give our veterans. They just need a little bit of that, and you can rub it on your knees, rub it on your neck, wherever, or your shoulder, wherever you're having, and then I just use a paper clip to close it over. And if that's the one that works for you, fine. If it's BioFreeze that works for you, that's fine. But I love Arnica because I use the Arnica for bruising or muscle aches and stuff. And it's a wonderful gel. And then the last one is this is a lidocaine. You know how they have those lidocaine patches? Well, this is just the lidocaine that you can buy on Amazon, and it's called TIDL, pain relief. And you just,
Patty,
Yes.
or anyone that can see, is the Sombra, Sombra?
yes, it is, Teresa.
Okay, thank you.
and somebody asked that, how you're rubbing in between your toes, your fingers and so forth. Can you do the same thing on your toes? Joy asked that question.
I've never, I've never the Achi fingers for arthritis. I've never done my toes, but I've always done fingers.
Mhm.
So I don't know. Someone will have to tell me if they've done their toes. I mean, I used to be able to touch my toes. I mean, think of us all as babies. We were chewing on our toes, It's like, where did that flexibility go?
What my question really was about when you said as long as they're not putting the Sombra between their toes, it's okay to put it anywhere. And why not between the toes?
Oh,
Just
okay, because
curiosity.
it's because you're it doubles the amount of absorption in there. There's more heat.
Oh,
Okay. And the other thing that's wonderful, that Sombra is wonderful for, thank you for reminding me, Joy, my diabetic veterans with their neuropathy, they love this.
okay.
So if they've got hand neuropathy or their foot neuropathy with the diabetic neuropathy, then no between your toes, but it is wonderful, because neuropathy can be quite painful. And then the other thing that I just want to mention a little bit, because we still have to get to insomnia, is also food. What you eat, the anti-inflammatory food. So you need that. You see now turmeric is being advertised, but cayenne pepper, nutmeg, but also look at the processed food. I mean, what I have our veterans, I said, if you can't pronounce it, why are you eating it? It's all that crap that's in there that's aggravating you, right? I mean, seriously. When you look at that, so get back to just the plain apple, and if you need the applesauce one, but don't go right to the apple juice. We need fiber in our bodies. So we do, at the VA that I worked at, we did a 3-week course on just whole food plant-based. And in that course, we've gotten 2 of our veterans off their diabetic meds, and their A1Cs are normal. So all these things are just different. Like I said, this is a smorgasbord. This is a buffet, to know that food is medicine. And excuse me, our philosopher of medicine said that in the 4th century, food is medicine. And why have our medical system gone astray and forgotten that food is medicine, right? Okay, so that's enough I think, for pain. I think I've covered everything that I wanted to. Now I also do Korean hand therapy too, which is fun, but that's something you can also look up, or just write me and email me. It's a whole nother way of dealing with pain. I want to get to insomnia, because You know how everybody talks to you about sleep hygiene. Are you watching the news before you go to sleep and you wonder why you can't sleep? Do you have the television in your bedroom? You know, do you have your phone right up your ear? You know, well, mine is no flip top phone, so I don't have to worry about that nonsense. But most of you have those blue phones. You know, I'm still an old fuddy duddy, and my great nieces and nephews all laugh at me, and that's okay. I said, it still works, it gets me where I want to go. And I know how to read a map. I don't have to do GPS. So, or I can ask for directions, you know, hello, yes. So getting back to insomnia, remember I told you about the goodie bag? Well, our veterans get two types of tea. They get sleepy time tea, which is valerian, okay? And they can have it hot or cold. And they also get yogi tea. They get a tea bag of yogi tea. That's in their goodie bag. And yogi tea has passion flower in it. So these you can buy at Walmart or at your local grocery store has them, okay? So that's for sleep. Now, the other thing they get a separate bag because I don't want because it really is strong. And now what did I do with the other bag? With a cotton ball, and they get 2 drops of Lavandula augustifolia, which is pure essential lavender oil. You know, lavender comes in many species, so that's why you use the Latin name Lavandula augustifolia. So I have them, they get this, I tell them to put it in a separate pocket. Don't mix it with your tea bags because then your tea will smell like lavender. But I tell them to put the whole thing in their pillowcase so that they can find it again. They don't have to run around looking for a little, you know, cotton ball. And one of our veterans came back and said, I slept 7 hours. He goes, what else did you put in that? I said, 2 drops, 2 drops. 2 drops of essential Lavandula augustifolia. So, you know, don't buy the fake stuff that's synthetic. Okay. You can go to NAHA, which tells you reputable places that you can purchase the essential oil that's been proven to be real essential oil and not be ripped off because some of the places charge you an arm and a leg for it. So they get that in addition to this. And then, okay, now this is another one that I teach them. You already know, I told you about the ginseng dough. They love the ginseng dough because when they're anxious, if you're anxious, you could just have that under the table and you can be doing that and nobody knows that you're anxious and you're taking care of yourself. But at nighttime, if you're going to bed with the breath work that we talked about and then the ginseng dough just on your tummy. And like I said, some of them fall asleep without even getting to their other hand. But now there's another one, whoops, that I want to teach you. And this is an old one. Let me just get mine. So the first thing that you do is you're going to cross left hand over right, left hand over right. And if you can put your fingers together, fine, and bring them up, or you can just leave them on your tummy. Or if you can't entwine your fingers, just put them together and lay them on your tummy, okay? Left over right, because what we're doing is we're telling our mind that we're quieting it down. We're not going the go, go, go. We're going into the relaxation. So left over right, and then cross your left foot over your right foot. And now, if you have your hands on your tummy crossed, or if you have them up, I want you to take 9 breaths. So this was Chinese 9 breaths. So the same 9 breaths that we've been practicing from the very beginning, breathing in through your mouth and out through your mouth, in through your nose and out through your mouth. 9 times. At your own pace, your pattern. And then if you're still awake, all you do is just uncross everything and put your fingertips together. So what you've done is balanced all the meridians again. So that's, and then I've actually had, and this was in the very beginning, I've had patients fall asleep with that, in that position. So they didn't even get to unwind or anything. So I know that that helps too. The other thing is, it doesn't have to be prayers, but just gratitude. What are you grateful for? And do we take the time to acknowledge what has little simple things in our life? I mean, yesterday was the first time that I've seen a dragonfly in a while. And to just take the time to enjoy and be grateful for that dragonfly to come across my path. And of course, it's June now, and at nighttime, I have all the lightning bugs in my backyard. And how exciting them saying, "Oh, you're looking for a mate. Oh, you're looking for a mate. How exciting." And just revel in that. Be, as Thich Nhat Hanh has always taught us, to come back and be that child of what you enjoyed in your life as a child. And just because we're in our 70s and close to our 80s, we can still do that. We can still taste that sweet cookie and enjoy it seriously. So if you don't want to do prayers, do gratitude. Just 3 things that you're grateful for this day. And then, of course, I'm going to do the 2 things. I'm going to do the 5-element meditation for you. And I'm also going to do the chakra connection for you. Okay, so the 5-element, of course, is Chinese medicine. And you know, Patty loves Chinese medicine. So if you want, put your hands over your heart, because it's always voluntary, both hands over your heart. And the heart is the fire element in Chinese medicine. And it is the color red, okay? And that's why brides in China get married in red, because the emotions that go with the fire element are joy and sorrow. So breathe in the color red and color your heart top to bottom, inside and out, front and back, with the color red. Breathing in what gives you joy and breathing out a sorrow. Now move your hands down to your stomach or your abdomen. And this is the earth element. And this is your spleen and your stomach, your yin and your yang organs. Oh, your yin organ is the heart for fire, and the yang organ is your small intestine. So now we are at our stomach and spleen, which the solid organ is going to be the spleen and the yin organ, and your stomach is the yang. And this deals with anxiety and serenity. So breathe in the color yellow and color your stomach top to bottom, inside and out, front and back, with the color yellow. Breathing in serenity. Grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference, and letting go of a worry. And then move up to our lungs. This is the metal element. And of course, the lungs are our yin organ, and our yang organ is our large intestine. And it deals with, obviously, grief and happiness. So breathe in the color white and color your lungs top to bottom, inside and out, front and back, with the color white. Breathing in what makes you happy and letting go of a grief. And of course, our urinary bladder is our water element, along with our kidneys. So the kidneys are the yin organ, and our urinary bladder is the yang organ. And of course, the color is blue. And of course, the emotions are courage and fear. So when you think we get nervous, we want to wet our pants, right? So breathe in the color blue and color your urinary bladder top to bottom, inside and out, front and back with the color blue. Breathing in courage and letting go of the fear. And our last element is the wood element, and it is your liver and your gallbladder. Even if you've had your gallbladder removed, it's under your right breast. And of course, the liver is the solid organ, the yin organ, and our gallbladder is the yang organ. And of course, it deals with peace and anger. So breathe in the color green and color, even if that gallbladder is missing, the energy is still there. Color your gallbladder top to bottom, inside and out, front and back with the color green. Breathing in peace and letting go of anger. And now we've come full cycle in our meditation of our elements, coming back to your heart, knowing that we are complete and whole and in balance. So that's the meditation for, of course, the 5 elements. The last one that I want to do with you before we do questions is, of course, the chakra connection, which I love, the spiral chakra connection. So if you put both of your hands on your heart, because the heart is the chakra of transformation, the chakra of love, of unconditional love and compassion. So breathe in the color green and leaving one hand on your heart, move down to your stomach area. This is the area of your solar plexus. This is the chakra of can do, I will, the chakra of empowerment. Breathe in the color yellow and then spiral up to your neck. This is your throat chakra, the chakra where we walk our talk and speak our truth. Breathe in light blue. Spiral down to your belly button area. This is your sacral chakra, the chakra of creativity and feelings. There are no right or wrong feelings. They just are. It's what we do with them. Breathe in the color orange. And then come up to your forehead. This is your brow chakra, the chakra of intuition, of making decisions and seeing things clearly. Breathe in dark blue. And spiral down over your pubic area. This is your root chakra. This connects us to Mother Earth. This is our family. This is our friends, the people that we play with, the people we pray with, the people we work with, the groups that we belong to, our Caritas group, our healing touch group, our therapeutic touch group, our yoga group, our Tai Chi group. Breathe in the color red. Spiral up to the top of your head. This is your crown chakra, the chakra of inner knowing, of aha. Breathe in purple. If you feel comfortable, place your palm up to the sky to connect to your divine source, whatever that source you believe to be, and ask that source to let you know what is in your crown chakra, what is in your brow chakra, what is in your throat chakra, what is in your heart chakra, so that we may love unconditionally and extravagantly in our solar plexus, in our sacral chakra, in our root chakra, and palm down to Mother Earth, so that we may manifest what is in our heart. And coming back to our heart, asking our divine source to stay in alignment with us. Oh. When you're ready, if you've had your eyes closed, open them. When you're ready, come back. So, thank you. Questions? Oh,
Yeah, good morning. I have a question.
yes, Art.
And first of all, I want to thank you for putting on your presentation today. I learned a lot about the different methods of controlling pain and all that. But my issue is insomnia. I'm having a lot of difficulty staying asleep all night. And I'm being treated for congested heart failure, and I'm on a couple of primary drugs, Entresto, Metropolyn, and Eliquis. And my dosage has been cut back quite a bit since I first was diagnosed with the congested heart failure. And they have it under control. As long as I take the medicines, I seem to be functioning fine. But I'm also getting these very vivid flashbacks, very vivid dreams, going back to even high school and beyond, further back than high school. And an interesting thing is one of my nephews was visiting here in LA with me a couple of weeks ago, and I mentioned it to him, and he says, well, he has a heart issue also. He's on the same Metropolyn that I'm on, and he's having these same vivid flashbacks about his life and all that. And I was wondering if you knew of a connection between any of these drugs and that particular situation, plus the insomnia that I'm experiencing. I just can't, I have a CPAP. I put it on, I take it off, I put it on, take it off. That goes on most of the night. And if I monitor my iWatch, which monitors my sleep, it says I'm getting 5 hours, a minimum of 5 hours of sleep most nights. But I don't feel that way. I don't wake up feeling refreshed. And I'm wondering if and I'm a veteran, by the way, and I also went to the Wilshire and the Northfield VA centers and talked to doctors over the virtual over the phone about this. They have a checklist. They go down, ask you 25 questions and all that, and they came up with no response or no reason for this happening. So have you heard of this before with the
No, I haven't
drugs?
heard of that with the beta blockers, but I can tell you that even with your CPAP and even with your chronic diseases, the techniques that I've got, especially the ginseng dough one with the fingers, that is very beneficial for you, especially if you wake up, like a lot of us when we're older, we wake up to go pee and then come back and can't get back to sleep. What I'm hearing you say, I think, is that your mind is doing a lot of wandering and of course with these flashbacks, whether they're happy or sad flashbacks. The other thing that I didn't discuss in this class is mantram, which the VA uses and has been researched, extensively by Dr. Jill Borman, who was the nurse researcher at the VA in San Diego. And mantram is, finding the word that is comforting for you, that will help you with your breath work and with that mantram, so that you get out of your mind and you stay in this, of course, there's also, I didn't go into a meditation on finding your happy place. And when you're in your happy place, that you can also feel less distress with your flashbacks that are bothering you. Does that make sense?
Sort of, but I was, this didn't happen until I started the heart medicines. So I'm sort of keying in on those myself. I'm hearing what you said, and I like your presentation about this sleep disorders and all that. So I could try a mantra, but
anyway, the other thing you can do is check with your doctor. There are different forms of beta blockers. Maybe that beta blocker is not the one for you. I mean, that's what we talk about Eastern and Western medicine combining to make the best care for all of us. That there are different beta blockers that can discuss that with your provider and share with them that this beta blocker, the metoprolol, is giving you flashbacks, and is there a substitute that you might try to see if that's it? That's an option, because we want you to be equipped and informed so that you can do your own self-care and live the best quality of life that we all want for each and every one of us.
Yeah, well, I have a virtual meeting with my cardiologist on one day next week. And I'm going to bring that up because I thought the same thing, maybe one of the beta blockers is causing the problem.
Okay, were there
Thank
other?
you very much. Yeah,
Oh,
thank you.
no, thank you. Thank you for your service too. And if you were in the Army, happy belated birthday. Yesterday was your birthday. What branch were you in?
I was in the Air Force,
Okay,
64 to 68.
all right.
Wow. What was both of his medicines were beta
Yeah.
blockers?
He
Okay.
was a metoprolol and Entresto, of course,
Uh-huh.
and then he also had the anticoagulant, the new one.
Yeah. Beta blockers have a lot of side effects, so I agree with you that he needs to talk with them. The other one I would invite or suggest perhaps is having his CPAP adjusted, because it may not be fitting appropriately for him, and that makes a big difference. And there's a high correlation in cardiac disease and I can't think of the word, not breathing properly.
Like apnea, sleep apnea.
Yeah, sleep.
Sleep apnea has people go
Yeah.
into the atrial fib. Yes,
Yeah,
yes. Correct.
It is very
Absolutely.
high. So I would invite that. My question is very simple. Where are you, Patty? Where do you live?
Oh, I live in North Carolina here now, in the town of
Okay,
Hollis,
good.
outside of Cherry Point.
Okay, good. Not that far from me. Good.
Oh, okay,
Northern Virginia.
okay.
Yeah.
Are there
And Mary Ann Hanley, do you know her?
I know Marion Hanley from Therapeutic Touch.
Yes, ma'am. She's a good friend of mine.
Okay. Yes, from long ago. Yes, I
Yeah.
took I was blessed to have Dee as my instructor in NYU. So
Oh,
we started back in the 70s with,
Mhm.
Frontiers in Nursing.
yeah.
So it's such a gift. Now, were there
Yeah.
any other questions in the chat room that I missed that I need to answer? Oh, someone asked about resources. If you send me your email, I will send you the Word that I give out to our veterans, a little Word document, because this is stuff that I've gathered through, obviously you realize now, almost 50 years of practicing these things. And what I always, like I said in the very beginning, I always say, even to my psych patients, I know something that might help, if you give me permission. And then, of course, I thought I was going to be fired from when I first did that, because here I'd been stationed here in North Carolina, and it was at a civilian hospital that I was working. And I didn't tell anybody that I was doing it, but I told my nurse manager in the morning, and I waited for the phone call for me to get fired, because I wrote that Therapeutic Touch was done on this patient, and then went home. And the next night I didn't get the phone call to say you're fired. I came into work and all the patients say, we want what he had. So and so that's when my nurse manager said, you need to teach this to the rest of the hospital. And I was truly blessed that for nurses, the North Carolina Board of Nursing had me go teach to different hospitals as a reward for the nurses that they selected to learn Therapeutic Touch way back when. Yeah.
One of the questions is from Neela, is where could I find that ear graphic?
Oh, you just Google, or Neela, you can just email me and I'll send you that one. But you just Google ear reflexology, and there's 50 millions of them. There's ones that will show the organs, ones that'll show the musculoskeletal that I showed you. No problem at all. And Jamie, you had a question. I saw your hand.
Janine,
Oh, I can't read the small print. Yep. Okay.
sorry.
I see now.
Yeah, by the way, I feel like I have to say I'm Carol Bergen's daughter. Hi, Mom. So I thought it was really interesting how you talked about the chakra. Well, I forget which one it was, but down near the stomach. So I started a new job in September, and I immediately started having urinary tract it felt like I was getting an infection, but I didn't really. And you mentioned courage and fear, and I just thought that was really interesting. I was probably subconsciously having fear. I wasn't even thinking about that until you said it. just now. So that
Our-
was really interesting.
It really are. If we only listen to our bodies talk to us. I mean, how many times do we, like I said, we say, "Oh, you're a pain in my neck," and we get neck pain. "Oh, you make me sick to my stomach." And listen to all the, or we even tell ourselves, "Oh, you're ugly, you're fat, you're old, you're blah, blah, blah." And we look in the mirror instead of saying, "I love you. You are a child of God." And I wake up every day and I thank him for another day to be of service.
Let's see, this Ramona is from, I think she says, which one is good for the neck? And I think, is she the one from Canada?
Okay, so remember I told you about Korean hand therapy, and I said I just mentioned it. Well, what's so much fun about the neck is that your hand in Korean hand therapy deals with, and the wonderful thing is you can do your neck on, where we flip our bird. This is your neck right there at the first part. And so if it's the front of your neck, just take a pen and get rid of the point, and just go along the area there and see if there's an area that hurts. Or you can use your nail, or if it's the the front of your neck, do over your nail. So that's the wonderful thing about Korean hand therapy. And the wonderful thing about that is if you've had your hand amputated, that you can still use, so if I'm using my right hand, this is my right leg, and this is my right arm, and then this is my whole body. These are my eyes and my teeth, and of course my lungs and my stomach and stuff for diarrhea and also constipation. And if I've had an amputation, I can still use these fingers, if I've lost my left hand, for my left arm and left leg. So, and then of course the neck, remember in the upside down fetus, the neck is down here. So you would be rubbing that area there. And then also when you do your, the whole area, that just relaxes your whole body. And think of it, all of our animals, do they not come up and say, "Oh, do my ears, rub my ears, I love you, I love you, I love you, do my ears," and they push their ear into our hands and stuff? They're so smart. Why don't we listen? We think we're the smartest, and we're not the smartest species.
And several people have asked for your contact information, and it's in the first chat. Can you all see? Go back to the top of the chat, and there's Patty's information. She's
please email me, call me. I'll go over. We can do a session. I will share. I mean, I've truly been blessed with the teachers that I've had in my life. Part of, I don't think Carol read, but part of my legacy is to pass on my love of nursing.
Yes.
And all truly everything that I have learned, because we all want to have less suffering in this world, and we were really made to be joyful spirits.
Absolutely. Did I miss any questions, or anybody else have any other questions? Let's see, it says the chat doesn't load prior to when participation got into the meeting. So if anyone joined after it was shared, we can't scroll further up to the chat from that moment we joined. So Patty, do you want to just tell them your phone number?
Oh, okay. Oh yeah, it's 252, area code 252-241-0467. So 252-241-0467. And my email address is NYC. Of course, I'm born and bred New York City, raised and educated there. NYCRN, which my family stands for real nut as opposed to registered nurse. And WIC, Wild Irish Catholic, at hotmail.com. And the reason I got that was when I got stationed down here in North Carolina, everybody would say, "Oh my God, you're from New York City." And then of course, they would say, I was redheaded at the time. So I was a redheaded nurse for them. And then of course they would say, "Oh, and you're Catholic," because here, this is Baptist country, honey. "And you're a wild Irish Catholic." So this has been my email from when email first came out. And it was my first license plate when I had to give up my New York license plate. My original license plate for North Carolina was NYC RNWIC. And people would stop me and ask me what it stood for. And then everybody would have a good laugh. And of course, my family was a real nut. Yeah.
Are there any other questions? So, you know, I was trying to
Mm.
check. Is there anybody else that had a question?
And the other thing I'd like to offer any of you that are here, I also do an 8-week program on the mind-body skills that we teach our veterans and staff at the VA. And it is a wonderful class that was designed by Dr. Jim Gordon for our veterans with post-traumatic stress disorder. And I do that, and I love doing it. So it's something that it helps our veterans, it helps anybody that's a healer, anybody that takes care of veterans. I mean, it's a worthwhile. In fact, Nyla can attest to it if Nyla is still on. And obviously, of course, yes, Carol can attest to it too.
Yes.
And Denise, yes, there are some people that have taken it with me and came back for seconds.
That's great.
Patty,
Yes.
my granddaughter just popped in, and her stomach hurt so bad she couldn't sleep the last 2 nights. What part of the ear? Could I get that graphic somehow?
Oh, of course, I will
Share
send it
with her.
Nyla, since I have your email address, I will send it to you, darling.
Bless you. Thank you.
Thank you. I'll take every blessing that comes around.
All right. Let's see, there's one new message that popped up. Thank you. You've
one
got
other
so
question.
many.
Oh, is there time for one other?
Oh, of course. Yeah, we got plenty. Oh, I know we're over, but yes. Okay. No problem. Yes.
Well, I was just curious. I loved how you put the tea in your goodie bag for the veterans. And I'm just curious if you heard a lot of feedback from them, because drinking tea at night to help with insomnia or just peaceful resting, I'm just curious. I mean, it seems like it would be such a huge impact. But I myself have trouble doing it. So have you heard feedback that people do it and it really works for them?
Yeah, some of them, yes, some of them do. Oh, and I forgot that they also get a piece of chocolate, and I also do a meditation on chocolate. So, yes, some of them, like, remember I said, try it all, because something will work for you that may not work for somebody else. And that's what I always ask them, to be open to the mystery, like Jean teaches us, and the magic of being able to heal, and being able to heal with each other and heal ourselves too. So yes,
Great.
try it. You can try it hot, try it cold. The other thing I didn't talk about was the melatonin, because people try melatonin, and we make melatonin. We just have all these lights on and we don't turn them down. So starting at 8 o'clock at night, if you're going to bed at 10, start lowering. If you're watching the TV, I know it's a different thing, but lower your lights. Or if you're going to take melatonin, take it at 8 o'clock if you're going to go to bed at 11, so it starts working on you. But we make our own melatonin. It's just that we're in all these crazy overhead silly lights that keep us, instead of chill, baby, chill.
Well, Patty, you've got amazing comments in here. Wonderful resources. Thank you very much. Bless you. Thank you for this amazing presentation. I mean, the information was therapeutic, relaxing, healing, just what I needed. Much gratitude. Love, you've gotten so many positive comments from the participants.
I just want you all to, even if, like I always wonder, when I started out with therapeutic touch, and it's like, or healing touch, and it's like, why isn't everybody doing this every day? You learn about your chakras, do it. Yeah. And, we have to take out the judgment and say, when they're ready, they'll be ready. So the same thing, if, nothing, it doesn't happen today, truly, be open to, for the neck, do try any of the BioFreeze or the Sombra or the lidocaine too, any of the salves for the person that asked about neck problems. Does that make sense?
Yeah.
So practice your diaphragmatic breathing. Get into that parasympathetic nervous system. Pretty please.
All right. Well, I guess we'll come to a close. Oh, there's oh, 6 new messages, Patty. Very wonderful sharing. I came late. Would like to hear the
Oh, they
entire
drink
present.
sleepy time. They drink sleepy time tea. Oh, wonderful. Oh, the entire presentation, Chandra, will be on the, Carol, you'll tell them where it's connected to.
Okay, it should be on YouTube, and you put in Caritas Healing Connections. And you could pick it up Facebook by putting in Watson Institute of Caring Science and scroll down to see, you'll see Patty's face, or unfortunately, maybe even mine. But one of us, you'll see it and you'll know that this is the presentation. So it's YouTube Caritas Healing Connections, and on Facebook, Watson Institute of Caring Science. And that Facebook has so many entries, you just have to scroll down to find it.
So I just want to say namaste, which means the highest good in me honors the highest good in you. But I also add, from a chaplain in the VA many, many years ago, taught me namaskar, which means when I am in my heart chakra and you are in yours, that we are one. So many blessings. Thank you for taking the time to take care of yourself and taking care of each other. Blessings on your day, and happy Father's Day to all of our fathers, and pray for the ones that we need to pray for, and be well and have fun, enjoy, and love.
Thank you so much, Patty. You are a blessing, and you definitely are unique. Thank you.
Blessings. Bye-bye.
Bye-bye now.